Three, start.
Hi, I'm Rajesh here. Today I'm going to show you the lumbar spine examination. I would like to invite Miss Ridhima. Hi Ridhima, thank you for allowing me to do the lumbar spine examination. Initially, I would like to assess the gait first as soon as the patient comes into the clinic. Ridhima, can you able to walk few distance? Yeah. So in this, the gait is normal. Usually, in the spine patients, if they have a severe paravertebral muscle spasm, this patient will walk in the clinic by sometimes holding the back itself, which is very stiff, and then they will have a short step gait or antalgic type of a gait. Now, examination of the spine, I always do in a pattern of inspection, palpation, range of motion, neurological examination. Then we do any special tests, look for any limb-length discrepancy, and conclude with abdominal examination and foot pulses. So now I would like to examine the back by looking from behind first. So from behind, if you see, you should compare both the scapulas, whether it is in the symmetrical position. Look for any obvious wasting of the muscles over the paravertebral muscle side. Look for the alignment of the spine, which is quite straight. In this, you have to look for if there any scoliosis present or not. Then nextly, I would like to see in a lateral position. Can you just turn like this? So in this lateral position, if you see the lumbar curvature, which is the lordosis, you have to see, which is followed by the thoracic spine, which has a kyphosis, and then again there is a lordosis of the cervical spine. So in this, there is a normal curvature of the spine, which is well maintained. Obviously, you have to look for any scars, sinuses, or any kind of lumps over the paravertebral muscles. Then on palpation, I would like to palpate each spinous process deeply, going down from the cervical spine all the way toward the cervical spine, lumbar spine. Then at the talar bone, which is formed by the sacrum, and the lateral to the sacrum is the iliac crest, there is a point which is called the SI joint. I would like to press it over both the sides to see whether there is any pinpoint tenderness present or not. At the same time, I would like to find any tenderness over the paravertebral muscles, lumbar spine muscles, which are on the either side of the lumbar muscles. You can also go down to the gluteal muscles, whether is there any tenderness present or not. After this, I would like to assess by doing the range of motion of the spine. So the range of motion of the spine, can be in the flexion, extension, and lateral rotation of the spine. So in this, can you able to bend forward without bending your knees? So she has a very good range of motion. At the same time, you should ask not to bend the knees while flexing the knee. So she has a very good range of motion. So at the same time, tell her to extend the spine. In this case, she has also very good range of motion in extension. Yeah, relax. Huh? So now I would like to see in a lateral rotation. Can you able to slide your hand all the way down? Yeah, bend on one side, same thing on this side. So this shows she has a very good range of motion. Before doing into neurological examination, I would like to exclude one important point. To exclude, is there any other cause of back pain? Where in this situation, we would like to do the renal punch, which excludes if there is any kidney pathology. So renal punch is done at the subcostal area, where you have to punch over this area or on this sides, both the sides. If there is any tenderness over there, by thumping on that particular area, that indicates there might be some pain coming from the kidney. So that excludes any extra spinal cause of the back pain. Yeah. Now the further examination I would like to do neurological. I will ask Ridhima to lie in a supine position. Just lie down with us. Okay. When the patient is lying on the couch, we take an opportunity to look for her limb-length discrepancy, which can be seen by comparing the middle malleus at the same time. We take an opportunity to look for the foot pulses also, dorsalis pedis and posterior tibialis arteries. So that also excludes any vascular causes. One thing we should always exclude in the spine patient is there any pain coming referred from the hip area, which can mimic a spine condition. So in this case, you have to ask, grossly you are evaluating the hip pathology. Flex the hip. This is the internal rotation of the hip. This is the external rotation of the hip. If the patient has any pain in internal rotation and external rotation, that indicates there might be pain coming from the hip pathology. At the same time, we can do the axial loading of the hip by pushing the femur to the acetabulum. If the patient complains of pain, that means it's coming from the hip. So in this condition, she doesn't have any pain as such. So it's very important to exclude the hip pathology before jumping to the spine examination. So on spine examination, now I would like to do the straight leg raising test. In this, you have to lock the knee first. You should not allow knee to bend the knee. So in this, the patient is asked to raise the leg up. Ideally, it should have at least 90 degree of flexion of the leg. If there is a restricted in the flexion, that means the patient, one thing, might be having a hamstring tightness. So this can be done by flexing the knee and Ridhima, can you raise the leg up? So if the patient cannot do extension of the knee fully, that means this much area is the angle which is causing hamstring tightness. But in this case, she can able to do it. If the patient has a positive straight leg raising test, that means the patient will complain of pain going down from the back, going down towards the leg. So this is the straight leg raising test. Now I would like to do the special test I would like to do later. Now I would like to start with the during straight leg raising test. You can do one more test as a Lascelles test. In this, which are provoking it's a tension test where you have to raise the leg up and dorsiflex the ankle. If the patient complains of a lot of pain, that means there is a severe pressure on the nerve or impingement of the nerve. The commonest cause is herniated nucleus pulposus, which is the prolapse intervertebral disc. This test is called the Lascelles test. Now I would like to do the neurological examination by doing first finding the tone of the patient of the muscle. So this can be just grossly done by bending the knee and find if there is any increased tone present or not. So then I would like to test the muscle power. So different myotomes are we need to test. So it starts from L3, L4, L5 and S1. So L3, in this it causes the quadriceps extension. So in this, patient is asked, can you able to raise the leg up strong? So I'm testing the L3, which is the knee extension quadriceps. Then in the L4, I'm testing the ankle dorsiflexion. Can you able to push your ankle towards you? Yeah. So this is the L4. Now I'm testing the L5, which is the extensor hallucis longus muscle, which extends the big toe. Can you able to push your big toe towards you or hallux? So this is quite strong. Okay. Then S1, which is the plantar flexion, which is caused by the gastrocnemius and soleus. Can you able to press it down? So this is the S1 myotome. Then I would like to test for the sensations. So in the sensation, you should always test symmetrically. So this one area is the L3 area. Can you feel I am touching you? This is the L4 dermatome. This is the L5 dermatome, and this is the S1 dermatome. So this is power sensation. Then I would like to do further tests by doing the reflexes. So in the reflexes, the knee jerk, ankle jerk, I need to test. So this is done by flexing the hip and flexing the knee. Ask the patient to relax and you to tap on the patella tendon. So you can see some contraction of the quadriceps muscles. It has to be done on both the sides. Same thing, the ankle jerk you need to do by flexing the knee and then slide and the dorsiflexion of the ankle and tell the patient to relax, and you can tap on the tendo Achilles tendon. So if you see, there is a response there. And lastly, with a soft instrument, you can do the plantar response by scratching on the lateral aspect of the foot, where you can see there is a flexion of the big toe and the other toes. So this completes my neurological examination. Then few other tests I would like to do is Faber's test or Patrick test, which is done for the SI joint. So this is done in flexing the hip, abduction of the hip and the external rotation of the hip. And if the patient complains of pain over the same side of the SI joint, that is the back, that indicates it's the SI joint pathology. Lastly, we would like to stress a little bit on the piriformis syndrome, where the piriformis muscle is a deep muscle which seated into the buttock area, which is, can you put it on one side a little bit? Which is around this area. The patient usually will complain of pain over the buttock area, and sometimes that will irritate or compress the sciatic nerve and will cause a pain going down the posterior aspect of the thigh. So piriformis muscle is a very strong external rotator of the hip. So in this case, can you put a line on supine? I would like to test the power of the piriformis muscle by externally. This is the external rotation. So ask the patient to push the hand towards, press my hand and try to test the external rotation power of the piriformis muscles. Can you able to push my hand inside? So this is, I'm trying to test her external rotation. So if she has a pain, that means I will suspect there might be some piriformis syndrome. Another way to stress that piriformis muscle is, you need to edit up the hip and flex the hip, and if the patient complains of pain over that area, that also goes in favor of possibility piriformis syndrome. I would like to conclude my lumbar examination by doing the abdominal examination, as we need to rule out the causes of spine, rule out the extra spinal causes of the back pain, so which can be coming from your abdomen, which can be any from the pelvis, from the liver, spleen, organs. It can, if it is a female patient, it can come from the uterus or fallopian tube. So in this, you need to do the abdominal examination by palpating and finding if there is any lumps or any organomegaly like hepatomegaly or splenomegaly present. So this concludes my spine examination. Yeah. Thank you, Rajesh. You can hear.